I. Ready to answer any question that you may have, so get those questions ready on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from one of our viewers. Today's first question comes from Tandy, who just reached out to us through our website, allhealthtv.com. Now, Tandy asks, "Hi, Dr. Camejo. I read an article recently that suggested that birth control pills could have an adverse effect on a woman's cardiovascular health. I've been on the pill for a number of years, and now I'm a little concerned about my heart health. I'd love to know your thoughts on this." Hi, Tandy. We appreciate you sharing your concerns with us. So, what's the deal, Dr. C? Can birth control pills cause heart problems?
Well, Tandy, it all depends on your overall health. You are more prone to have heart problems on birth control if you are over the age of 35, you're a smoker, you have high blood pressure, you're diabetic, or have ever had a heart attack. So birth control contains estrogens, which increases blood pressure. So women who have high blood pressure on birth control do have a risk of stroke or heart attack, compared with women who don't have high blood pressure. So keeping tabs on your blood pressure while you're on birth control is really essential. And that way you can monitor yourself. But also hormonal birth controls can also affect your cholesterol. So sometimes it'll lead to a plaque of accumulation in your arteries, and it also leads to a heart attack or stroke. Marissa, what are things that you're seeing in your patients, and what other factors would you consider?
Yeah, as you mentioned, there are many things for women to consider in regards to birth control and their cardiovascular health. One of the major risks with birth control is the increased risk of blood clots, especially in smokers and women over the age of 35. There are also some non-modifiable risks, or essentially risks that you cannot change, such as your gender, your age, family history, and race. So according to the American Heart Association, 80% of people who die from cardiovascular disease are 65 years old or greater. And while many people consider cardiovascular disease to be primarily a men's disease, it's the leading cause of death in women in the United States. The risk for developing heart disease increases if you have a relative who developed heart disease at an early age, and African Americans are at a greater risk of developing cardiovascular disease. So while there are some things that you can't control, there are other lifestyle choices like birth control or smoking, which could enhance your risk.
Thank you so much, doctors. Okay, heads up, we have another question. This is a YouTube question. It's coming in hot. It's from Mickey, and her question is, "Dr. Camejo, I'm 52 and I've gained a little weight recently. I've also had what I can only assume are hot flashes. Does this mean I'm close to menopause? And what are the most common symptoms of menopause, and how can they be managed effectively?" What a great question. What do you think, Doc?
Well, hi, Mickey. I have a few thoughts, but let's check out this video from our friends at the National Institute of Health first.
Maria is 45 and is having night sweats and trouble sleeping. She wonders, are these changes related to menopause? What are the signs and symptoms of menopause? Women begin experiencing changes in midlife that could be related to aging, the transition to menopause, or a combination of both. Often, changes happen to the menstrual cycle, the body's internal thermostat, sleep, vaginal health, sex drive, bladder health, and mood. A woman has reached menopause when she hasn't had a period for a full year. Changes in your period might be the first thing you notice. Periods may be inconsistent, shorter, longer, or lighter or heavier than usual. Many women experience hot flashes, a sudden feeling of heat during the transition and for many years after menopause. Women may start having difficulties falling and staying asleep. Hot flashes at night or night sweats can make this worse. The vagina may become drier, which can make intercourse uncomfortable. Your feelings about and interest in sex may also change. Some women start to have bladder control issues. They may have a sudden urge to urinate or be unable to hold their urine. You might feel moodier or more irritable. Many women experience mild menopausal symptoms, but for others, symptoms can be severe. Not everyone's experience is the same, but remember, menopause is a normal part of aging and not a disease that must be treated. If your symptoms are bothering you, talk with a doctor. Learn more at www.nia.nih.gov/menopause.
So as mentioned in the video, the common symptoms are hot flashes, night sweats, sleeping problems, and vaginal dryness. Now, you can talk to your provider about hormonal replacement therapy to see if that's right for you. But there are other ways to help manage your symptoms that are over the counter. Mostly common used is black cohosh, is often used to help manage hot flashes. And another good one is maca powder. Maca comes from the root plant in the Andes Mountains, and studies have shown that this nutrition had an impact on hormone levels as women reported improvements in their symptoms. So for vaginal dryness, you can use vaginal moisturizers or lubricants, which are often recommended to provide relief. And also consider eating foods that are high in phytoestrogen and have antioxidant properties that can show some benefits, like soy with edamame, soy milk, tofu, legumes, kidney beans, chickpeas. Seeds are also good, sunflower, flax seeds, or even sesame seeds, and even fruits like strawberry, cranberries, peaches, nuts like cashews and almonds, and teas like black or green teas are also good. But remember, if you're going to take any supplements like maca, talk to your doctor or pharmacist first to make sure that they're not interacting with any of your current medications.
Thank you, Dr. Camejo. Okay, we got a terrific Facebook question here, but I'm going to take a pregnant pause before I share Brandy's question. Okay, pause over. Dr. Camejo, I just found out that I'm pregnant. Not me, Brandy. It wasn't something we planned for, but there you go. As a result of this unexpected blessing, I have a million questions for you, but I'll limit myself to one. What medications can I take during my pregnancy? Congrats, Brandy. Okay, Dr. Camejo and Dr. Mauricio, what are some of the medications that you can take? And I'm sure there are many that you absolutely cannot take. Am I right?
Kathy, you are right. First, always consult your doctor prior to starting any prescriptions or over-the-counter medications during pregnancy. I can't state that enough. But there are several medications to avoid that you need to find alternatives and work with your physician, such as NSAIDs or ACE inhibitors, beta blockers, or even calcium channel blockers, which are used for blood pressure. So the choice depends on the individual health factors. Marissa, what are some of the recommendations you're giving to your patients in clinic?
Yeah, some medications that I often see in the clinic, which need to be stopped during pregnancy, are retinoids. These are often used for acne. Some examples are Accutane, tretinoin, or adapalene. I also see benzodiazepines like Xanax or Klonopin, which are medications used to treat anxiety. And these have been linked to miscarriages, low birth weights, and premature births. So these medications are not recommended to be used during pregnancy. There's also NSAIDs, like Dr. Camejo had mentioned, for example, ibuprofen, naproxen, or diclofenac, which should be avoided in pregnancy due to the increased risk of life-threatening kidney problems in the baby. Statin medications, these are used for cholesterol, as well as the ACE inhibitors, which are used for blood pressure. And these have been shown to be unsafe in pregnancy as well. So it's important to discuss your options with your doctor and consider the overall risks of both the mom and the baby's health when taking medications while pregnant.
Thank you, Dr. Mauricio. Now, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Finally, someone reaching out to us through the gram. This question comes from Natalie, and she wants to know, hi, doctor. My mother and my aunt both went on hormone replacement therapy. My aunt had some complications and died a few years later of breast cancer, but my mom never had a problem. I want to know what the risks and benefits are of hormone replacement therapy, HRT. This is a really good question. Who wants to take it first?
So that's a great question, Natalie. And every great question does deserve a great answer. So I would say that the benefits and risk of taking HRT really depends on your age and your menopause symptoms and any risk factors that you have. So if you're under the age of 60 and have menopausal symptoms and you're not at risk for like breast cancer or blood clots, the benefits of HRT are likely to outweigh the risk. And so the main benefits of HRT is that it does relieve most of the premenopause and menopause symptoms, such as mentioned in the video, like hot flashes, night sweats, sleeping, vaginal dryness. Those are all great. But it also helps prevent osteoporosis by increasing your level of estrogen, which is really in need for healthy bone. But the most important thing is to talk to your provider to see if he can help you decide if HRT is right for you.
And the next question comes to us from Matilda, who reached out through YouTube. She asked, Dr. Camejo, I'm a postmenopausal woman and I want to know how I can reduce my risk of developing osteoporosis. I'm not postmenopausal yet, Dr. Camejo, but I love the 411 and osteoporosis. What can you tell us?
So Matilda, that's a good question. But before I give you and Kathy the 411 on osteoporosis, let's check out a video from our good folks at the Mayo Clinic.
Osteoporosis is often called soft bones.
Osteoporosis is thinning of the bone to the point where the bones can break.
Dr. Bart Clark, a Mayo Clinic endocrinologist, says common breaks from thinning bones occur in the spine, wrist, shoulder, and hip.
Women in general past menopause, past the mid-50s, are at high risk for this because of the degree of bone loss they have due to the lack of estrogen.
The standard screening procedure for osteoporosis is a bone density test. Treatment is a combination of medication, adequate calcium and vitamin D intake, and physical activity.
So the perception is sometimes we can't fix it if it's a problem. It's just the opposite these days.
Dr. Clark says if you have osteoporosis, you need to be careful not to overexert your body, which can lead to fractures. But in general, simply walking for 30 minutes, 3 to 4 days a week is the right amount of physical activity. For the Mayo Clinic News Network, I'm Jason Howland.
So osteoporosis is more common in women than men, but men do get it. So you have to look at that as well. But the primary risk factors for osteo is advancing age. But there are a few risks that also increase the likelihood of that. And race is one of them. So white and Asian women are more at risk for osteo. Body size, so people with small frames, family history of osteoporosis, hormones that are low levels of estrogen or testosterone, and certain medications like long-term use of antidepressants can also lead to osteo. And also look at your lifestyle factors like excessive alcohol drinking or low levels of physical activity and smoking can also lead to osteo. But take steps to limit some of these risks, but there are other things you can do to maintain bone strength and prevent osteo. One thing for women, definitely take calcium and supplements. Women over 50 need at least 1,200 milligrams a day. Exercise regularly so that it impacts bone strength, and muscle strengthening is one of your best defenses. Add more lean proteins to your diet. More protein intake creates higher bone density for you. Remember to get enough vitamin D. That's always great, which a lot of sun. But limit your alcohol consumption because it does affect the balance of calcium in your body, and it impairs your body's ability to actually produce vitamin D when you're exposed to too much sunlight. So heavy drinking can create hormone deficiencies. And maintain a healthy weight. So people overweight also have an increase. And if you smoke, quit, because studies have found a direct correlation between tobacco use and osteo.
Fantastic information, Dr. Camejo. Now let's see what we got here. This is a great question for parents, especially. This one came from Facebook, from Nala. And she asked, "Say, doctors, it's almost time for me to have the conversation with my young daughter. I'm obviously talking about sex and birth control. My husband had a vasectomy, so it's been a while since I've given much thought to protection. Can you tell me about the different types of birth control and their effectiveness? But seriously, doctor, what should men, I have to say men and women, know about birth control these days?
So Nala, I appreciate the outreach, and I'm happy to hear you're going to have that important conversation with your daughter. I remember having those conversations long ago. So I'm going to let Marissa practice and answer this one.
So there are many different forms of birth control to consider. One of the most common forms is the birth control pill. There are two types, one that has a combination of both estrogen and progestin, and the other one is progestin only. Fun fact, recently the FDA approved the first over-the-counter birth control pill. It's called the O pill, which does not require a prescription. With perfect use, birth control pills are typically about 99% effective. The most effective non-pill birth control options are going to be long-acting contraceptives. So this includes implants, which are placed into the arm, or the intrauterine device, also known as the IUD. And these are over 99% effective, and they can be used for many years at a time. For those who aren't afraid of needles, there is a contraceptive injection, and these provide birth control for several weeks, and they have about a 94% effectiveness rate. There are also vaginal rings, which last several weeks, and weekly birth control patches, which could be considered. These are about 91% effective. And another common option are single-use condoms, which can also be used to protect from STDs or sexually transmitted diseases. And when these are used perfectly every single time, condoms can be about 98% effective. So as you can see, there are many different options to consider for birth control, depending on the effectiveness, to how long you have to take each of these, how long they last, how invasive they can be. I always recommend talking about these options with your doctor to get the most information and to understand what would work best for you.
Thank you, Dr. Mauricio. Okay, Dr. Camejo, looks like we got another question from the gram. This time it's from Carmen, and she asks, "Hola, Dr. Camejo, my husband and I just found out that we're pregnant with our first child. Are there certain vitamins or supplements that I should be taking during my pregnancy?" Now, Dr. Camejo, before we jump in to answer Carmen's question, which is it's great, I would love to also, because we know that prenatal vitamins are a must when you find out you're pregnant, but I want to find out too about medications that you actually can take as well, not just vitamins and supplements, but medications that you can take while you're pregnant.
So many of the medications, there are medications you could take, but I think it really depends on the condition. To list on all the types of medications you can take, it would be a long list. But depending on your condition, that's why I always say talk to your doctor, because there are meds you can take that while you're pregnant. But the most important thing is really for pregnancy is to please check what prenatal vitamins lists contain on, because not all prenatal vitamins are the same. So the most important minerals that you need to take are like folic acid. Very important. It plays an integral role in DNA synthesis, red blood cells production, and fetal growth and development. So folic acid, at least that is really an important one that you must take. Iron, you need iron because iron increases significantly during pregnancy, especially as baby's growing. Magnesium is another one that plays an important role in immune and muscle and nerve function. The other thing that you should look at is also fish oils that contain DHA and EPA. These are two essential fatty acids that are important for the brain's development. And also choline. Choline plays a vital role in the baby's brain development and helps prevent abnormalities in spine and brain. But I would also look at vitamins that you should not take. Don't take vitamin A. There are high doses of vitamin A can cause birth defects. High doses of vitamin E can also increase risk of bleeding. Other supplements like black cohosh can cause early labor and miscarriage. So that's why it's really important before you add any other supplements, always check with your gyno and make sure you go over what you would like to have.
Very helpful, Dr. Camejo. Thank you. Now, if you got questions, we've got answers. And just in case you missed it the first couple of times, I'm going to remind you again, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, here's a question that gets straight to the point. It comes from Mariana through our YouTube page. Dr. Camejo, are there specific medications for managing high blood pressure in women? Now, Marissa, that's a great question. I know there are lots of medications out there for managing blood pressure, and that's why we have you on here today, but there are some that are specifically for women. So, Marissa, can you break that down for us?
Absolutely. Well, Kathy, when treating blood pressure, there are no specific medications developed specifically for women. Typically, medications prescribed for blood pressure are based on how elevated a person's blood pressure is and potentially other health conditions that they may have. So as we briefly mentioned before, so we talked about ACE inhibitors, which is an angiotensin medication that helps with controlling the blood pressure. Some examples would be captopril or lisinopril. There's also angiotensin receptor blockers like Cozar or losartan. And these are considered harmful during the second and the third trimesters of pregnancy. So if a woman is of childbearing age or she's planning to get pregnant, you would want to discuss an alternative blood pressure option with your doctor to make sure that your blood pressure is staying under control and reducing that potential risk.
Thank you for that. Okay, this next question comes from Miranda, who asks, can you discuss the symptoms and treatment options for endometriosis? Very important question. Docs, what are your thoughts?
So the most common symptom for endometriosis may include like pain in your lower tummy, your legs, pelvic area, or even your back. That usually worsens during your period. Abnormal and heavy irregular periods, period pain that stops you from doing anything or any normal activity, pain during sex or after sex, and feeling sick, constipation, diarrhea, bloating, all during your periods. It's really bad. But in order to really determine if you have endometriosis, your doctor will have to do a physical exam. And this may include an exam of your pelvis or your ultrasound with an MRI, and in some cases, a referral to a surgeon, which may be placed to perform a laparoscopy to check the tissue inside your abdomen. Marissa, any other thoughts on this?
Yeah, well, there's no cure for endometriosis. There are treatments to help with the symptoms of this condition, such as pain medicine, hormone replacement therapy, like we talked about earlier, HRT, contraceptives, progestin therapy, as well as potentially surgery, or in severe cases, potentially a hysterectomy.
Thank you, doctors. We have time for one more question. This one comes to us from Filomena. What are the potential health effects of chronic stress on women, and how can it be managed? Who wants to take that one?
So Marissa, you're going to take that one.
Yeah, of course, of course. So when it comes to stress, this is mainly due to an activation of the hormone called cortisol and other stress hormones in the body, which can disrupt almost all of the body's processes. So long-term activation of the stress hormone puts you at risk for many different health problems, including anxiety, depression, digestive problems, headaches, muscle tension, and pain as well. And so some ways that you can manage stress really include getting regular physical activity on most days of the week, practicing relaxation techniques, so trying deep breathing, meditation, yoga, tai chi, or even massage, keeping that sense of humor. It's great to laugh on a daily basis, many times a day, spending time with your friends and your family, and then also setting aside some time for your hobbies. So like reading a book, listening to music, going for a walk, those types of things. Scheduling time for your passions is important. Writing in a journal is great for stress relief, as well as getting enough sleep throughout the night. That's very important. Eating a healthy, well-balanced diet, and then staying away from tobacco and alcohol use, and especially the use of illegal substances.
Thank you so much, Dr. Mauricio. Anything to add, Dr. Camejo, before we go?
No, I think, I like to go to spas. That is one of the
That's
things
not a
that I
bad way.
do.
That's not a bad way at
I
all.
definitely want to go, we all have stress. Kathy, you do too, especially managing family as well as her children and even work. Women have a lot on their plate all the time. And it's usually a lot of, we don't always take care of ourselves, which is right. But, really taking care of that, that's important. And going to a spa, enjoying yourself every once in a while. If you can't take care of you, it's going to be very hard for you to take care of your family.
Mhm.
Absolutely. We put ourselves first. And I'm joining you at that spa, Dr. Camejo. Please space for me there. So that's all the time that we have for today. I want to thank Dr. Camejo and Dr. Mauricio for joining us today on Ask the Doc. I'm Kathy Buccio, and I'll see you next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.